Good afternoon. My name is Dr. Petrikovsky. I'm a professor of obstetrics and gynecology, and the ideas expressed in this video does not necessarily agree with the ideas of the institution I'm affiliated with. What I would like to talk today is the topic that became very important later, and that is persistent positivity for coronavirus. The scenario is relatively simple. Some people know they had the disease, they tested positive, then after a while they went for another testing, they were still positive, they have absolutely no symptoms. Some people were positive 5 consecutive times. And the question is, what to do with this particular individual? Should you consider him still infected with coronavirus? What's the role of it? And what goes on? And I'm talking about antigen testing. I'm not talking about antibody testing at this time, because in some cases, that's why the testing is so confusing, that some of those people are positive for antibodies and some of those people are negative for antibodies. So the whole idea of testing that some fake TV doctors are discussing nonstop is not very clear to us. The amount of testing, the intensity of testing. The question is what to do with the results. I think, and some virologists think, that the reason for persistent testing is super sensitivity of PCR, that occasionally that not only detect the entire virus, but it can also be positive if you can get viral particles or pieces of RNA that can stay in the body for longer time. So the question is, the practical question is what to do. And at that time, the best answer comes from CDC. CDC recommends to consider person non-infective after 2 consecutive negative testing. The question is, how do you treat patient if you cannot get 2 consecutive negative testing? Well, according to the current guidelines, they're still considered potentially dangerous as far as spreading COVID-19. But the data from Korea and the data coming from the recent publication on virological assessment of hospitalized patients is telling us that the degree of infectivity of people who have 0 symptoms and are persistently positive is significantly less than in those people who are positive with symptoms. And probably the reason being is that they don't cough and they don't spread virus actively. But if you let them come back to work, they definitely should use every possible precaution to protect other people from coronavirus that they may still carry. Thank you and stay safe.